Namaste and good morning to all our transplant recipients. A lot of you have expressed concern about the ongoing coronavirus pandemic, and I am recording this video to share with you some facts that we know about the coronavirus and what you, as transplant recipients, can do to stay safe during this period of the epidemic. Now, one of the things that is known to us is all influenza viruses are usually viral to begin with, and which is one of the reasons why you are advised to take periodic or annual flu vaccinations, which help you build up immunity against the known influenza viruses. Now, coronavirus is one of the family of viruses which is a common cause of this cold infection. This particular strain, or the COVID 19 as it is known, is the cause for its recent pandemic. What is known is that the infectivity rate of this virus is quite high. That is, it can get transmitted very easily, but the mortality rate is probably similar to that of other viruses. So there is no need to fear or no need to panic. Who is the vulnerable population? All people who have their immunity that is suppressed compared to the normal population stand a higher chance of catching the infection. These could include small children, elderly people, or transplant patients who are on immunosuppression, that is, they take medicines to reduce their immunity. So they will always be more susceptible than peers of their age group to catch any of these, whether it's viral or bacterial infections. So what can be done? Now, there are two common methods of transmission. One is droplet infection, which is by the droplets that are spread into the air when we cough or sneeze. So one of the common ways of avoiding this is not allowing people with any known infection to come in close proximity to you. If anybody in the house or any family member has an infection, let them stay isolated in a part of the house and not come into the room where you are staying. If there is any friend or relative, ask them to avoid coming to meet you till the time that they are completely free of infection, which is about 2 weeks from the time that they develop these symptoms. Another method of transmission is fomite transmission. That is, if somebody touches their mouth or face and then touches any surface, be it a table, chair, or any object, and then you happen to touch it at a later point in time, then the virus will come to you through the from the surface that where it is being lying. So one of the common things to avoid is hygiene, personal hygiene. Hand washing is very important. Whenever you come from outside, wash your hands with soap and water. And the other thing is always wash your hands again before eating food, and just maintain normal clean habits. Another thing to follow is avoid visiting public places where there are large gatherings of people and you do not know who has what infection. This would include going out to restaurants, movies, large functions, family functions like weddings if possible, and public transport. Even air travel or flight travel is not advisable at this point till this epidemic settles down. Now, what to do if you have common features suggestive of stuffy nose, cold, sore throat, or body pain or fever? Now, remember that this period does not mean that any flu infection is caused by this coronavirus only. It can be caused by other viruses which commonly cause flu as well. And during this period, what you need to do is just take rest, take steam inhalation, take warm saline gargles, take paracetamol. If the symptoms do not subside within 1 or 2 days, then call your doctor, call your physician, family physician, or your general practitioner. And if they advise you to come to the nursing home or the hospital, then go there. If you are otherwise well, then there is avoid going to hospitals in general. For any other queries or any clarifications, please feel free to reach out to us, and we will try to help you in whatever way possible. Thank you. Stay safe and stay healthy.